Atrial fibrillation, often called atrial fibrillation or AF, is the most common type of heart arrhythmia. An arrhythmia is when the heart beats too slowly, too fast, or in an irregular way. When a person has atrial fibrillation, the normal beating in the upper chambers of the heart, the two atria, is irregular, and blood doesn't flow as well as it should from the atria to the lower chambers of the heart, the two ventricles. Atrial fibrillation may occur in brief episodes, or it may be a permanent condition. An estimated 2.7 to 6.1 million people in the United States have atrial fibrillation. With the aging of the U.S. population, this number is expected to increase. Approximately 2% of people younger than age 65 have atrial fibrillation, while about 9% of people aged 65 years or older have atrial fibrillation. African Americans are less likely than those of European descent to have atrial fibrillation. Because atrial fibrillation cases increase with age and women generally live longer than men, more women than men experience atrial fibrillation. Some people who have atrial fibrillation don't know they have it and don't have any symptoms. Others may experience one or more of the following symptoms: irregular heartbeat, heart palpitations, rapid, fluttering, or pounding, lightheadedness, extreme fatigue, shortness of breath, chest pain. The risk for atrial fibrillation increases with age. High blood pressure, which also increases in risk with advancing age, accounts for 14% to 22% of atrial fibrillation cases. Risk factors for atrial fibrillation include advancing age, high blood pressure, obesity, European ancestry, diabetes, heart failure, ischemic heart disease, hyperthyroidism, chronic kidney disease, heavy alcohol use, enlargement of the chambers on the left side of the heart. Atrial fibrillation increases a person's risk for stroke by 4 to 5 times compared with stroke risk for people who do not have atrial fibrillation. Strokes caused by complications from atrial fibrillation tend to be more severe than strokes with other underlying causes. Atrial fibrillation causes 15% to 20% of ischemic strokes, which occur when blood flow to the brain is blocked by a clot or by fatty deposits called plaque in the blood vessel lining. Atrial fibrillation costs and consequences. More than 750,000 hospitalizations occur each year because of atrial fibrillation. The condition contributes to an estimated 130,000 deaths each year. The death rate from atrial fibrillation as the primary or a contributing cause of death has been rising for more than 2 decades. Atrial fibrillation costs the United States about $6 billion each year. Medical costs for people who have atrial fibrillation are about $8,705 higher per year than for people who do not have atrial fibrillation. Atrial fibrillation treatment. Treatment for atrial fibrillation can include medications to control the heart's rhythm and rate, blood thinning medication to prevent blood clots from forming and reduce stroke risk, surgery, medication and healthy lifestyle changes to manage atrial fibrillation risk factors.